Good afternoon, everybody, and welcome to the meeting of the Council Executive. Could I thank everybody that's joined me, councillors, officers and guests at the actual meeting, and also those watching live or watching clips of the meeting afterwards. You're all very welcome. The first agenda item is declarations of interest. If members have any additional declarations, if they could indicate virtually, and then I will bring you in at that point in the meeting. I know at least two have to, so Councillor Dugorn.
Yes, it's in reference to item 6 on York bid, prejudicial interest as a director of the bid on behalf of the council.
Thank you. Councillor Waller.
Thank you, Chair. Similarly, I am a director of the bid on behalf of council and therefore will not take part in that item.
Thank you very much. I can't see any further declarations of interest to make. So that then takes us on to agenda item 2, the minutes of the previous meeting that are included between pages 1 to 10. So I'll just give anybody an opportunity to raise any matters. If not, if I could please see all those in favour of accepting those minutes. Thank you very much. That's a clear majority in favour of accepting the minutes. That then takes us on to agenda item 3, which is public participation. We don't have any registered public participants this afternoon, so that means we can then move straight on to agenda item 4, which is the forward plan. This is set out between pages 11 and 14. Again, just to give anybody an opportunity to raise any issues. If not, could I see those in favour of accepting the forward plan? Thank you very much. So again, a clear majority in favour of accepting the forward plan. That then takes us straight on to agenda item 5, which is the recovery and renewal update for January. And this is included between pages 15 and 50 of the executive pack. And we're also joined by a couple of guests for this item, Mike Holmes and Maddie Ruff, who I think are going to now automatically pop up and join us on the live stream. So just to say very much welcome Mike and Maddie to the meeting. And to first introduce the report though, I'm going to hand over to Ian.
Yes, thank you, Chair. Clearly, since the last time we were here and given the monthly update, in York, case numbers have increased quite dramatically, and Sharon will just give you a bit more details and clearly present the very latest position for York. We obviously have been focused in terms of a response to that and trying to obviously keep the numbers down. And again, Sharon can talk more about the additional testing we have been doing throughout the city. We've also been continuing to push for communications to residents and remind people in terms of what people should do. Clearly, it is a challenging time, challenge in terms of the hospitals and the NHS in particular, and that will continue for a number of weeks. And I think just want to pay tribute, obviously, to all of our colleagues in the NHS in particular, who are clearly dealing with some very difficult circumstances. But also, as we'll come on to, are equally trying to give obviously positive outcomes in terms of the rollout of the vaccines, which do offer a way out of this, hopefully. For the council, clearly in recent weeks, very much the focus has been on providing support across a range of issues. So a lot of support has gone on working with schools, and that has been a challenging period, clearly, for the schools. And again, I think just to recognise the huge amount of work that schools have done in very difficult circumstances. Obviously, we continue to support the NHS, in particular through adult social care. We are supporting businesses in terms of further rounds of business support grants, and that is specifically mentioned in the report in terms of specific work relating to the economy. We also providing extensive support to our staff, so ensuring that their well-being continues, providing further testing of staff, and obviously we will be supporting our staff in terms of the vaccination programme as well. And finally, just supporting residents clearly in terms of our community hubs, and as I mentioned, further communications going out to residents. I just want to pay tribute, I think, again, to all of our staff who continue to work and clearly in difficult circumstances providing a range of services across the city. Just in terms of this report for this month, there's a focus on in Appendix 1 in terms of the economy and our response in terms of some of the impacts that that has had. And clearly, whilst the next few weeks the focus is on responding to the current crisis, we do also need to look ahead to hopefully coming out of this on a more permanent basis, and clearly with a view to York's economy rebounding as well. We know people still want to come to the city, the attraction of York will still be there, and clearly we'll continue to work with all sectors to support that in coming months and continue with our major capital programmes as well. Clearly, Tracy or Neil may want to say more specifically in terms of the report on the economy. And as you mentioned, Chair, there are some colleagues from Health Service here to give a further update in terms of the vaccination programme. And obviously Sharon will also wish to comment in terms of the latest figures. So I'll stop at that point, Chair.
Thank you very much for that, Ian. Sharon, if I bring you in now, and then after I'll then ask Mike and Maddie to follow you, if I may.
Yes, thank you, Chair. So yes, since we last met as an executive, there has been a significant rise in the number of positive cases of COVID in York. Our latest data shows that we have a rate of 670.9 per 100,000 population. And just to put that in context, the national rate is 654.9 per 100,000 and the regional rate is 338.8. So that means that York has a positive case rate, which is significantly higher than the regional average, but is also higher than the national average at the moment. We're continuing to focus on our pandemic response in accordance with our agreed outbreak control management plan. We continue to focus our efforts on prevention through communication messages, particularly guidance around hands, face and space. We are significantly extending our testing offer. So we've been doing asymptomatic testing for some time now. Started that before Christmas, and that offer has recently been extended to include anyone living or working in York who through this lockdown period is required to go into work and can't work from home. And also using our local data and intelligence to target community testing to where we know we've had outbreaks, and then also focusing on contact tracing. We're in the process of extending our contact tracing program to accommodate the additional numbers that are being transferred to us from NHS Test and Trace, and obviously also supporting people with all important self-isolation if they've tested positive. our contact tracing service, as well as supporting people to access the national isolation grant if they're eligible for that. We've also, as a council, put further investment into our local discretionary scheme to be able to support households and individuals who are finding it difficult financially to be able to self-isolate. The work, particularly with schools, universities and colleges, is ongoing to ensure that staff and students have access to testing, and we're starting to roll out our partnership working to employers across the city as well. So lots of activity going on. I am hopeful that we will start to see the impacts of lockdown start to impact on our case rates. And so hopefully what we'll start to see now by the end of this week and into next week, I very much hope that we will see our case numbers start to fall. But for now, the message to residents is to double, for the whole city really, is to double our efforts to get control of the virus, and asking people to be very careful and to follow those hand space guidelines. Thank you, Chair.
Thank you very much for that update, Sharon. If I could now hand over to Mike and to Maddie with a welcome and thank you for coming along this afternoon.
Yeah, thank you, Councillor Aston, and thank you for the invitation. So what I'd like to do is just really give you an update in terms of what's happening with vaccination. Maddie and I represent an organisation called Nimbus Care. Many of you may not know or have heard of Nimbus Care, but essentially Nimbus Care is an organisation that's formed by all of the GP practices in the city of York. So 11 practices have come together to form this organisation, which effectively provides care at the scale of the city, at the 200,000, 250,000 population level. So where it's appropriate, we step in to provide on behalf of our practices, and that's what's happening with COVID vaccination. So we have developed a vaccination site at the old Askham Bar Park and Ride site, and your colleagues in the council have been incredibly helpful in enabling us to do that. We started off on the site providing a service for general practice for our 5 primary care networks, and we've done that. Those of you who've been down to the site will notice there's a large marquee on the site, and that's where we provide the service for the patients, for the people of the city of York. And the reason we've done it at scale together collaboratively is so that business as usual general practice can continue. I'm sure you remember in the first part of the pandemic, you know, there was an issue with people not attending general practice, and the non-COVID pathology, the non-COVID illnesses were building up, and we want to try and avoid that, which is why we've done this at scale together. I will add that Hackspeed Group, part of the West Outer and Northeast PCN, did also start delivering vaccines to the over 80s, and they've pretty much covered the over 80s and will now join in with the citywide service at Askham Bar, although we will continue to run satellite clinics, perhaps at weekends, from the Hackspeed site. We're also going to run satellite clinics from Pocklington, because obviously their patients, the patients in that area would have quite a long drive to the Askham Bar site. So that's our local vaccination service site. As of Monday, we've been commissioned by the NHS to deliver a national vaccination centre. So many of you will have noticed that earlier this week there were 7 centres that were launched. We're going to be in the wave 2, and we'll launch a national vaccination centre from Askham Bar from Monday. You may well have noticed that there's been modular buildings installed on the site by Portakabin over the last 2 weeks, and we'll open them officially on Monday. That's going to provide us with at least, sorry, in the initial stages, it'll provide us with an additional 8,000 vaccination appointments, and they're going to be for both patients and health and social care staff. The way patients book in are slightly different. So for the PCN vaccination service, practices will be inviting their patients to come into that service in accordance with the Joint Committee on Vaccination and Immunisation priority cohorts. For the National Vaccination Centre, the way people will be invited into that will be twofold. They'll use the national booking website, which went live last week, and they'll be invited to do so by the NHS. So the NHS are going to be sending out letters to all people who live within a 45-minute travelling radius to Askham Bar to invite them to book in to that system if they wish. We're also running our own booking system, which we'll make available for health and social care staff. We're working with our local CCG to ensure that that booking link gets distributed to employers across health and social care in a systematic way as we move forward. The other two areas that I'd like to update you on is on our care homes. So clearly our care home patients are in a group that are the most vulnerable to coronavirus. So we've been working with our practices to vaccinate them, and we're well on our way to vaccinating all of them, we hope, by the end of this week, or early next week. And we know that group is really important. The data that comes out suggests that for every 20 vaccines we deliver to that cohort of patients, we prevent one death. So they're a clear priority for us, and as I say, we're well on our way to vaccinating all of our residents in the City of York. Equally, we're vaccinating the staff in care homes and are making similar progress. We'll shortly be starting to deliver care to housebound residents. Clearly, again, they're some of our most vulnerable people. The reason we haven't done that so far is twofold. One is to do with vaccine supply, particularly of the new AstraZeneca or Oxford vaccine. So up until this week, we've really only had Pfizer vaccine, which you may know is we're not able to move that around. It destabilizes very quickly when we move it. So we've not been able to use that vaccine for housebound patients. We're now getting good and reliable supply of the AstraZeneca vaccine. In fact, we've just taken supply of 1,200 doses at Askham Bar this afternoon, and we're expecting significant numbers next week. And that'll enable us to put together a program where we can systematically vaccinate patients who are housebound. And we'll be starting that on the 23rd of January. In terms of how many we've done so far across the city, we've vaccinated in the region of 12,000 people so far, which has been really good progress. And it has been slightly hampered by supply issues, although that's a national problem and is one that is being worked through and ramped up. And the final update I think I'll give you is just regarding the collaborative effort here. So there's been a real collaborative effort in providing staff for the services. When these two services are up and running, we'll be working 7 days a week, 12 hours a day. And as you can imagine, that requires an awful lot of staffing. So our practices have been really good. Sharon and her local authority teams have been really supportive. Our hospice are providing staff. We've got some local foundations, so newly qualified dentists supporting us. We're inviting back retired returners back into the system. And we're also developing our own bank of staff. So I think our sense is that we're going to be okay from a staff perspective, but if not, there's additional support from the regional and national NHS teams, which we will tap into if we need to. And yes, that collaborative support has been palpable from the beginning, from yourselves at the council, from our local hospital trust, from the NHS, and from local businesses. All the infrastructure that you see on this site at Askham Bar has been provided by local businesses. So actually this vaccination program has sort of supported the local economy, and that's felt really, really positive. So I think on that note, actually one final thing I will say is the hospital are part of this vaccination program as well. So they've set up a hospital hub and are delivering in the region of 7,000 vaccines a week. And they are primarily focusing on staff, health and social care staff. So I think between the three services and the satellite clinics, we've got significant capacity. And once the supply issues are sorted out and we get enough supply to match the opening hours that we can deliver, then those numbers that we're vaccinating will ramp up very quickly. So I'll stop there, Councillor Aspden, and obviously Maddie and I don't know whether Maddie wants to add anything to that, but we're very happy to take any questions.
Maddie?
No, I think Mike's covered it all for now, but I'm very happy to answer questions.
Great, thank you to Mike and again for both of you being here. I'm sure there'll be some questions before I open the report for questions and comments, including to Mike and Maddie. I think it's fair to say from my perspective, and since our last recovery and renewal update, which came to us before the new year, that the landscape that we live and operate in has changed significantly again. In recent weeks across the country and in York, there has been an alarming increase in the number of cases of COVID-19, as we've heard, particularly since the emergence of the new variant of the virus. And in response to this, as you will all know, the government tightened national restrictions similar to the one back in March. And in response to this, the report tonight outlines the ways that the council has worked to ensure that crucial services can continue in order to support anybody that needs help. And for me, point 20 highlights one of the immediate priorities, which is to ensure that frontline services can continue to serve communities throughout that period. And given the potential impact on council staff as well of sickness, this will include the redeployment of staff where necessary to adapt to the ongoing crisis. Sharon mentioned this, but outlined in paragraph 12, lateral flow testing has been made available to more residents who do not display symptoms, specifically those who are aged 18 and over and come into regular contact with people due to their work, for example, those in retail or taxi drivers. And the same tests are also available to those who work, live or support those most at risk from the virus, and also to secondary school pupils if the school has advised a pupil to be tested. And at the same time as all of this activity, I know that the council will continue to lobby the government for everything we need as the city to get through this crisis, whether that be further financial support for struggling local businesses, financial support for those on low incomes who are self-isolating, for example, so that we can respond more effectively to the emerging challenges, and we'll continue to make that case. Lastly, I know that this is not the new year that any of us would have wanted, but some of us may have anticipated it. And the new few weeks and months will be difficult, but particularly those working with GPs in hospitals and across the NHS. So we must all play our part to protect the NHS by following the latest national guidance. And I know that the people and businesses of York have already demonstrated their resilience over the past 12 months. And now with the vaccine rollout underway, and it was great to hear more details from Mike, we must not let up. So with that, very happy to open it for more comments and questions. Councillor Orrell.
Got it. Thank you, Mike. That was very, very helpful and very informative as to what's been happening. My ward is Huntington and New Earswick, and we're served by Haxby, of course, who have been proactive in the vaccination process. But for other residents, they're not quite sure what's happening. I looked on our GP website this morning, and the information there is not very clear as to what's going to happen for people in the process. There is something there, but it's hidden among other issues and not very clear in what it's saying. If that could be improved, I think that would be very helpful for many residents. And you did mention weekend clinics, that if that could be included as well, because some residents will find it difficult to get to Askham Bar. particularly, well, they may be able to get help if they're housebound later on, but that will help them as well. Thank you very much.
Mike, anything you'd like to say? And equally, Sharon, if you want to come back in, do indicate. Mike.
No, thanks for that, Councillor Orrell. I mean, obviously communication is really important here, and I think, you know, as the program starts to evolve, we are producing more communications, and we'll be able to ask the practices to put links to those comms on their websites. I think at the beginning, because vaccine supply has been a bit of a challenge, we have just been advising patients that they will be contacted when their appointment is available, and that still remains true. Obviously, if anybody has issues with getting to Askham Bar, then you know, we can discuss options for them. But to be honest, we've had, you know, we must have vaccinated 8,000 over 80s down here, and what I can say is they've been amazing. The way that people have responded to this, the experience here is actually really quite positive. You know, they can drive up pretty much to the door of the service, and if I compare that around the country to other, and this is not a competition, I absolutely get that, but when you look at other areas, actually many of the services aren't even providing parking. People are having to travel on public transport or park significant distances away. So what we've tried to do is make this as user friendly for all ages at Askham Bar. If people are genuinely housebound, there will be a different service for them completely. But you're right, we're going to put satellite clinics on at Haxby and also in the south at Pocklington. And actually, it may well be that we develop that service a little bit further as we go through. But at the moment, there's no absolute plans to do that for the time being.
Yeah, thanks, Matt. All that information is good, and I think it will be reassuring for a lot of people if that was more publicly aware.
Can I just come in there, Councillor? I think you make a really valid point, and I am currently working with our comms and PR people to try and develop that. So I'll undertake that as an action to make sure that next week we get more information onto all of the practices' websites. I'm also just in the process of developing some frequently asked questions, so we'll get those out there as well for the public. We will be able to issue some maps and things just to show like a patient journey for them, so that they know exactly what's going to happen to them once they come onto the site, and all that we're in the process of producing that. So I recognise it's not quite there yet, but I can assure you that it will be over the next few days.
Great, thank you very much. That's great.
Councillor Craghill.
Thank you. Yes, it was just a question which I wondered if one of you might be able to respond to, about the order in which people are receiving vaccines, and this seemed to come up as a national issue in the last day or so, just to a degree, I think. That obviously it's by age group is the general approach, but that there are some people who are much younger who are extremely vulnerable. But it appears, and I might be wrong about this, but it appears that they don't seem to be giving any more priority, that it's still by age group, even though they're exceptionally vulnerable. I just wondered if anyone could respond to that.
Yeah, thank you for the question, Councillor Craghill. I think the Joint Committee on Vaccinations and Immunisations, which is a national body, has really looked at the evidence about where the vulnerabilities are, and what we mean here to vulnerability to really serious illness or death, and that's why they've based their priority list on age, which seems to be the most important factor. And there was a document published at the end of last week, which told us how many vaccines we have to give in each cohort to prevent one death. And I referred to that earlier. For care homes, it's 20 vaccines, and for the over 80s, it's actually 160 vaccines, which, you know, as a doctor, as you know, to have a treatment that is that effective and that impactful is phenomenal, really. I don't think I've ever delivered a treatment that has had that sort of impact in my entire career. In terms of your question, the clinically extremely vulnerable, so what we used to call our shielded group, they come into the cohort with the over 70s. So I imagine we'll be getting to those I think we'll be through our over 80s cohort hopefully by the end of next week. I suspect another week or two to get through the over 75s, and then we'll be into our clinically extremely vulnerable group.
Right.
And then all other people with a chronic condition that puts them at higher risk of disease will be included with our over 60s cohort. So we will get to them, and they will obviously take precedence over the sort of under 50 general population.
Thank you for that.
Councillor Waller.
Thank you, Chair. It's been very interesting to get this update. I just wanted to understand a little more about the steps that have been taken to guarantee a more regular supply of the vaccine, which you mentioned, Mike, as being a limiting factor in the number of people you can vaccinate in the city.
Yeah, so we're in constant communication with the national teams who oversee distribution of vaccines. You know, I think the challenge is that this is a national problem in terms of the number of vaccines that have been ordered by the government from the various companies. I think we knew there was going to be a hiatus in the import of the Pfizer vaccine throughout January, but we're expecting significant numbers to come in February onwards. And of course, we heard that the government had purchased 100 million doses of the AstraZeneca vaccine, but of course, not all 100 million doses are produced at the same time. So there's a lag in terms of how quickly those vaccines get into the system. What I can say to you, though, if we look at our national data, I think the Northeastern Yorkshire have vaccinated more people than any other area in the country. So again, it's not a race nor a competition, but actually we're right up there, and I think that feels really positive despite the supply issues. But sometimes it has been a bit tense, if you like, waiting for supplies to arrive. I was very relieved to see the delivery van arrive about 2 hours ago at Askham Bar, and that means we've got secure supply for the next week. But beyond that, we don't really know, although we're being told supply is going to get better and better.
Thank you very much. Councillor de Gorn.
Yes, I've got a question which sort of relates to the geography and the points you made about obviously the vast majority of people will prefer to come by car if they have a car, of course, but I don't know whether you have included in your information about the provision and the sort of for people who are not coming by car and using public transport or cycling, even as you move down the categories. And the other point was from my ward is on the east side of the river. For anybody from our side, if they're not coming by car, it's 2 bus trips. So like facility in the university area would be far more accessible for a lot of people on the east side of the city. So whether that's sort of something that will be looked at as you move down to the more mobile level section of a population.
Yeah, I think so. The first thing to say is that access to the Askham Bar site is, you can access. There's good bus. I know you've talked about 2 buses there, Councillor de Gorn, but there is bus access. That we do have a walk-in service available, and also people are cycling down there. So actually, when we were planning the site with your colleagues in the council, they were very clear that having non-car access was very important, and we made sure that we included that. I think as we move forward, then we will certainly look at all other options and take a view as to whether or not we should develop any further satellite sites. I think one of the key factors is this ability to maintain general practice as a service, because people don't stop getting ill because of COVID, as we know. All the regular illnesses that we see absolutely continue. So that business continuity of general practice is really important. I'm also very aware that duplication just requires more staff and more infrastructure, and so there are some practical issues that we have to take into account. But rest assured, we will be taking everything into account, and our plans are not cast in stone. We're very happy to be adaptable to the needs of our population, because at the end of the day, that's what we're trying to do. We're trying to protect our population as quickly and as effectively as we can.
Councillor Myers.
Thank you, Chair. I'd like to thank Maddie and Mike for the update on vaccine rollout and the questions that have gone there. I don't have an extra question. I've got a question about business support. But just quickly before that, I do also want to express support for those people who are working through this third lockdown on the front line. The business support question, it might be for the member for economy or member for finance. I'm not 100% sure, but it's about the approach to business tenants through this lockdown and whether the council's expecting rent payments or if there'll be deferrals, what type of flexibility is going to be available to keep small and predominantly small and independent businesses afloat. And on that approach, I just wanted to ask about if it's a case-by-case basis, is that approach a fair and transparent one, whereby there'll be a matrix and modelling for reaching agreements, or is it going to be a case-by-case basis approach that's led by negotiation? And finally, linked to that, I just wanted to ask about I think it's paragraph 20 something, where it talks about the £4.2 million in additional restrictions grant. How do you envisage that being spent? Are the two questions there linked? I appreciate your answer.
Thank you very much. What I'll do at this stage, I'll just double check that there are no more hands up. So I'm thinking there are no outstanding questions for Mike and for Maddie. So I'll just echo that thanks for joining us today and that presentation, which was incredibly useful. And I think that outcome of highlighting that information as much as possible, and I'm sure the council communications team will take that away as well, but equally say, if you'd now like to leave us, please feel free to get on with everything that you're doing. So thank you both very much.
Thank you.
Thank you everyone. Bye-bye.
Thank you.
We'll now go in a sense to the substantive report that's in front of us. Given Councillor Myers' questions, I wonder if I could ask Tracy Carter, who I know is available to pick up questions in her area, to pop into the screen. And then similarly, I know that Councillor Waller is going to speak later, and I'm sure we'll then pick up the aspects around business support as well. Tracy, anything you want to say or respond?
Just to respond to Councillor Myers' questions, on the question of the negotiations with our own commercial tenants about their rent payments, as we did all through the last 3 quarters of last year, we've undertaken individual discussions with tenants to be able to arrive at arrangements for the repayment of the rent on those properties, and that is very different for different businesses, different levels of rent, different levels, different impacts on different sectors. So we haven't got some kind of rules-bound matrix to apply. We've arrived at individual agreements with each tenant to be able to reflect the particular problems that they're having. And I'm quite happy to report that at this current point, we are actually achieving 80% of the income on our commercial estate and have arrived at successful arrangements with the vast majority of our tenants. Clearly, the third lockdown will have an ongoing impact, and we are staying close to those discussions with tenants, particularly the ones who are in those sectors most impacted, and will continue to have those discussions and revisions to those agreements should there need be. I think the issue of a further deferment is something that we are keeping a very close eye on and will be discussing with members in the next few weeks. In terms of the distribution of the additional restrictions grant, which is referred to in the report, we've yesterday had confirmation that the government has awarded us a further £1.87 million of additional restrictions grants, and we are taking a report to the executive member session for finance performance and economy on Monday to look at the criteria for the distribution of those grants. The criteria that have been applied were the ones that we used for the first round of additional restrictions grant, and which went to exec member in November. And this report asks members to note those decisions, to continue to undertake work on the development of a proposition for business support voucher schemes, which we're doing with the university, to allocate an initial £200,000 from that additional relief grant to be able to prepare to fund future activity aimed at accelerating our recovery when we come out of lockdown. And that we will be bringing back a further report to the exec member on Monday to look at some of the eligibility criteria limits that we found from the first round meant that some businesses were excluded. That report is due to be published tomorrow and will be discussed on Monday.
Thank you very much for that. Councillor Waller, I know you were going to make some comments about business support. I don't know if you want to do that now. You're muted.
Thank you, Chair, and I'll deal with those points now. I think Tracy's covered most of the issues there. Clearly, the paper on the additional grants with a slight increase in the amount of money available, that will be coming to the decision session for the executive member for finance and performance. I shall be there, and I know that a lot of businesses have supplied information to the economic growth at York UK email address, even. So much social media at the moment. But I think it's been helpful to have all of that information in one place. I accept that there are many supply chain companies that have been brought into the equation at the moment, and therefore this is about ensuring that with the resources that we have, remembering that with the first £4 million across 7,000 businesses, that relates to £600 each. So it is not a huge amount of money, but ensuring that it's targeted, and that if there are instances where businesses do need additional support, then they should come forward to the economic development team. Again, I'm sure that businesses are wanting to be able to access the latest round of grants, the £4,000 to £9,000 for retail, leisure and hospitality. It would be enormously helpful if government issued guidance at the same time as ministerial statements, because there is always a time lag, and that information is due imminently, so that we can factor that onto the council website and therefore enable the payments to proceed. Clearly, the scale of that transfer of money does also rely on the government providing us with the cash to passport out. But we're very conscious that businesses need that cash injection to keep going. But I'd like to pay tribute to the officers who have worked diligently through this. I've seen the very complex chart of different tiers, payments, and it's a very difficult and complex situation, but they are dealing with it as quickly and as efficiently as they can. Thank you, Chair.
Thank you very much for that. Councillor de Gorne.
Thank you. On a different sort of theme, from paragraph 38 onwards, there's quite a significant reference in this report to the work that's gone on in transport, and the reference to the work that was did over the summer in relation to Foot Street supporting city centre businesses is mentioned on paragraph 41 onwards. I also wanted to recognise that this is not necessary for the immediate future, but acknowledge the reference in this report to the importance of supporting public transport, and the fact that, as it says in paragraph 45, that in order to manage congestion levels as we come out of any lockdown period, we do need to do everything possible to encourage people to use public transport, which the operators, as has been said on the previous discussion, work quite closely with the operators on planning the recovery phase, which, as we've already experienced, is not going to be as straightforward as simply going into lockdown and then recovery. It is something which we need to develop over a period of time. So I welcome the comments in this report, and the fact that we do acknowledge the contribution that transport, whether it's coach operators, park and ride, that all make to our local economy as an important element that we need to support.
Thank you very much for that. I can't see any other indications to ask questions or speak. So we have the recommendations in front of us, as I said, between pages 15 and 50. If I could see those in favour of accepting them. Thank you very much. That's a clear majority in favour of accepting those recommendations on agenda item 5. That then moves us on to agenda item 6, which is the York Business Improvement District renewal ballot. So yes, Councillor Dugan and Waller will be leaving the meeting for this item. I'm pleased that we've also got a guest for this item, Andrew Lowson from York Bid. So if anybody here for this item could join us on the screen. For this, I'm going to first hand over to Neil and Tracy to introduce the report, and then I'll invite Andrew to add any comments that he wants before opening it to questions. Neil and Tracy.
Thank you very much, Chair. So York Business Improvement District is approaching the end of its 5-year term, and it's compelled by the legislation by which it was set up to go back out to ballot of its members to seek approval for a new prospectus. If the ballot were to fail and to attract a majority of its members by number or value of ratepayers, it will automatically come to an end at the 31st of March. So the vote is now due to take place between the 18th of February and the 18th of March, and that has been changed since the paper was written due to the implications of the most recent lockdown. And I think Andrew can cover that when he speaks afterwards. So the paper in front of you this evening summarises what's been achieved by the bid and what we see as being a very, very successful first term. Sets out the key themes of the bid's prospectus for the next 5 years, establishes a renewed baseline of CYC services to be delivered in the city centre, and seeks the support of the executive for the bid and its prospectus, and requests that the leader cast CYC's votes in support of a future term. CYC is a major levy payer as part of the bid, with £25,000 per annum for 15 different properties. And on behalf of the bid, we collect the levy payments of over £800,000 per annum. More importantly, we have come to see the bid as a key partner in the city centre and beyond, working together on many, many projects over the last 5 years. And these are summarised at para 8 of the report. So the bid's key role in city centre activity has been very much highlighted over the past few months as we've worked together closely with other partners to support the economy through the COVID emergency. Our work together at College Green, for example, has helped thoughts and ideas turn into real practical actions on the ground, supported by the business community, and making sure that people in York can have a great experience in the city, and business can make a decent income during very, very difficult times. Just a few things that the bid undertakes. Without the bid, there would have been no Micklegate's run soapbox challenge, no York Restaurant Week, no street rangers, and none of the 15 kilometres of Christmas lights, which feature so often now when York is highlighted as a city that loves Christmas. And when we finally emerge from the current pandemic, all of our experience points to the bid being crucial in ensuring that our city centre economy bounces back strongly. the case for supporting 5 more years is a strong one, and the bid has proved very popular with the majority of levy payers. And just as a bit of a kind of note of a conversation I've had recently with Caroline Franks from the Federation for Small Businesses, she identified that the bid is seen as a strength for the city that adds both practical operational value to the city, but also helps to get involved in the definition of longer term strategies, particularly around the future of the high street. They're seen as a keystone of the business community, being well engaged with businesses and with other partners. And the bid, in the way that they do business, are aspirational in their vision. And they back that up with very strong data-led decision-making and consultation with businesses and grassroots delivery on the ground. So in recommending this report to you, there is a few details to just to draw your attention to. In the light of the experience of their first term, the bid are increasing the minimum threshold for membership to those businesses with a rateable value above £17,500, where the current lower limit is £12,500. This removes 213 very small businesses from the requirement to pay a levy without having very significant effect on the financial income from that. So it's a very positive step which will reduce the cost of collecting the levy, as streamline communications, and also mean that fewer businesses actually have to pay the levy. That will leave 912 members contributing in the geographic area covered by the bid shown in Annex 1, which remains unchanged. Can I also just propose a small amendment to recommendation 1 in the report, where the current wording refers to a citywide ballot? That should actually just refer to the bid area. So can we change that recommendation to support the bid in their campaign to secure a second term in York through a ballot of all businesses in the bid area set out in Annex 1? Annex 2 of the report sets out the baseline commitments of the council to provide services in the city centre, and this is very important. It's a requirement of the bid legislation, as the bid provides services that are over and above and complementary to the council offer. Annex 3 to the report was unfortunately omitted from the original published report. It's now available online, and that sets out the bid prospectus. And perhaps I can invite Andrew Lowson to take us through the main elements of what they're planning for the coming 5 years.
Thank you, Tracy. I'll try to be concise. I'll maybe take about 5 minutes of your time. And just to clarify, yes, Tracy alluded to the fact that we've changed the ballot date. The main reason for that is, as you know, with lockdown, there's a lot of businesses not able to, well, not necessarily accessing their premises at the moment, and we have to be quite precise on where we send ballot papers. So we've delayed it a little bit, so it allows us to communicate with businesses to see if there's an alternative address they'd like us to send it to, hence the reason we've pushed the date back a little bit. Yeah, thank you for the opportunity to speak. And appreciate you know, some of the words that have just been said. I mean, there's no two ways about it. COVID-19 has brought unique challenges to the business community, and as a result, you know, unique challenges to ourselves as a bid, especially in a year where we've been doing a lot of consultation. But what I would say, when you try to look at the positives out of these situations, I think it's definitely strengthened relationships with our members. There's members that we've been engaged with that we haven't done previously, and I think you know, certainly with the wider business community organisations as well. So you know, the fact that CYC chairs a regular meeting involves the FSB, the chambers, ourselves. I think that's not just led to good partner working, but some tangible outcomes in response to COVID, and I think that's been a real positive. There's no two ways about it. You know, COVID's obviously going to have a long-term impact on how we view, well, the world, and York comes into that. But I would say that you know, the challenges that York face, some of the key challenges, you know, they were relevant pre-COVID. I think, you know, we often talk about, you know, large retail space having been under pressure, the need for more mixed-use space in the city, you know, more people living in the city, how we balance tourism with, you know, family-friendly activity for locals, you know, that they were all there before COVID. I think they're very relevant going forward, and they're part of our business plan. I'd say what we are, I mean, going back to what I just alluded to with the connections of the business community, I think we're much better connected actually to tackle those projects head on, and we mustn't lose that opportunity of that partnership working that has really come together over the last year. In terms of looking back 5 years ago, in terms of the business plan we've been working to, I'm proud to say, and huge thanks to the board, the team, and partners that we've actually achieved 99% of what we said we were going to do. And if you look at bids across the country, that's not always the case. We've stayed true to the prospectus, and I think that's therefore put us in a good position. Some schemes have taken longer than others, things like the wayfinding and signage, which has just been put in the city centre. We started planning that 4 years ago, but as I've come to learn, nothing's easy in the public realm. But other programs like street ranges, winter lights, street cleansing, they're all things that the businesses said they wanted to see, and we feel we've delivered well on that. And at this point, yes, many thanks to CYC for their backing in these programs, and also the fact it mentions in the report, we've had an additional 800k from the City Council to back the programs that we've done, which, considering we've got a £4 million turnover over 5 years, that's a substantial amount of money. I don't think that would happen if we didn't have trust between our organisations, and a willingness to work together. And again, I can tell you from colleagues across the country at other bids, that is certainly not always the case. So I think we should all be collectively be pleased with that. Going to the consultation we've done with businesses, really, in a nutshell, the main feedback we got was they'd like to see more of the same. They value the programs that we've done well at. And obviously we take that as a compliment, because it shows that, that they think we're delivering well on the programs. So if you to ask me, or what our prospectus says, what are we going to do differently, or how are we going to evolve, is probably the better way to look at it. I think hopefully, should we win a second term, I think that will allow us to maybe take a bit more of a strategic approach on things. What you find with bids in their first term is that they tend to be very reactionary, very delivery driven, so that people are aware of what they can do. And we don't want to lose that, because I think that's what we're here for, that's what people want. But I think we can be a bit more strategic, and maybe touching on some of the things we've talked about before. I think we're quite well placed to really help the City Council with some of the exciting developments that are coming up, things such as Castle Gateway, York Central, possible plans for Coney Street. It's how we take that part of work here the last year, and we really help develop those plans and really aid the City Council with how we get businesses involved, shaping that. And I think that's something that we'd really like to be involved in. I think, supporting better integration between physical and digital, I think, that's something which, again, COVID has shown that if people haven't got, digital as part of, helping them future-proof their business, then they're not necessarily going to be future-proofed. So I think we really need to think about how we can help with training and learning for businesses in the coming 5 years. We've actually changed one of our headings from, we used to have a heading of events and festivals. We've changed that to the experience economy. And that's not to say that we won't get involved in events and festivals, but I think, what we've learned, over the past few years is, sometimes actually, if you can animate parts of the city, so rather than having a festival that's maybe just lasting for 2 days, do things that actually last for a period of time, that can be sometimes more effective. And just little things like anybody who's seen the recent tree at the Eye of York that we've dressed with lights, it can change colours, it can even react to your voice if we have the microphone there, which kids love. Those type of things bring a smile to people's faces and lights up a dark part of the city. And I think there's a lot to be said for that. And I think there's people down in the Riverside Quarter who'd like to see that type of thing down there, because not only does it help the appearance of the city, but it helps businesses if it pulls people down. I think green and sustainable. I think if we didn't have this in the prospectus, that there'd be questions, rightly so. And again, I think aspirationally, how can we get people talking about York as they sometimes do about the likes of Bristol, seen as a kind of leader in that field. And we've touched on this with trying to bring in a trade waste with forward recycling offer, which is all about trying to give better recycling offers in the city. But I think how can we do more visible things, and follow suit of things like the the electric scooters, which are very visible statement, I think, that York is moving in the right direction, and we'd like to look more at that. And then finally, I think accessibility. I mean, we often talk about how people get into the city. I think we'd like to work with the council and partners really to better understand the data on that, and then communicate that to businesses, because it's not just about how people get in now, it's about how they want to get in the future, and I think we can probably help with that. So yeah, that's really all I had to say. I mean, the business plan, we've literally just put the finishing touches to it, so that's why it wasn't included in the pack before you, but that will be available online at our website. Obviously, it gets posted out to all the businesses as part of the renewal ballot, at which point they vote, and then we will find out what the outcome is after the 18th of March. So thank you for your time.
Thank you very much for that, Andrew, and for joining us today. So I'm more than happy to open the item to any questions or comments. I think if I go to Councillor Myers first.
Yeah. Oh, thank you, Chair. And thank you, Andrew. I thought it'd be right to just say very, very briefly how much I appreciate the work of York Bid and how supportive we are of the organisation, and particularly the leadership shown and work put in by Andrew and others on that board. I think you do bring York's business community together in a really positive way, and it is a very significant role. So I hope the ballot comes through as it should. I think just to end, I'd say the window dressing has been fantastic over the years, but the Debenham storyboard, there's no bigger endorsement than what I can give to you from my little 2-year-old that loves that Spider-Man window. So well done on that.
Thank you. That's very kind. And yes, I mean, I suppose going back to some of the the situations that you get with COVID that wouldn't normally have happened. I mean, getting access to that building, would have been difficult in normal times. I mean, the prop company who helped us, a local prop company, Event Prop Hire, and if I'm being honest, we might not have been able to afford the display because they do a lot of work down south, etc. So yeah, I mean, again, a good example of being able to bring together local businesses in York, and yes, it was. We've got a lot of good feedback along those lines, Councillor Myers. So thank you for that.
Thank you. And I was just going to say that I think, as already highlighted, the partnership with the bid has been really important in the ongoing work to support not just businesses and the local economy, but also residents through the pandemic and more widely, as the report sets out over the last 5 years. And I think it's pretty clear in the report that during the 5 years of operation, the bid has delivered a series of initiatives that have really helped to support traders during a prolonged and especially difficult period for high streets across the country. And I think the partnership has set out how the report rather has set out how, in partnership with the council, initiatives just like some of the ones we've heard about, Parliament Street Works, College Green, pop-up space, bid ranges, have worked and been successful. And I think with businesses continuing to face uncertainty, this work of the bid and with the bid in partnership is going to be even more important to protect jobs and livelihoods. And I hope that partnership will be key as we move towards recovery and rebuilding our local economy. And with those comments, I think I'd just like to place on record my thanks, and on behalf of the executive, to the staff and volunteers of York Bid for their work since 2016, and most particularly over the last 10 months, as our city continues to face this unprecedented challenge. And hopefully with everybody else's approval, I would be happy to vote to support the bid as part of the ballot renewal process. So thank you, Andrew, and please pass it on to your staff and volunteers.
Many thanks. Thank you for your time again.
I can't see any other indication. So with that recommendation from me. We've got the report and the recommendation between pages 51 and 74, and that recommendation is slightly amended as suggested by Tracy. So could I please see those in favour of accepting that amended recommendation? Thank you very much. That's a clear majority in favour of accepting that recommendation. So Andrew, feel free to drop out and enjoy the rest of your evening. And we can now welcome back councillors de Gorn and Waller, if they could be told to join the room. I can see that Andy has joined us. Oh, and Andrew, well, welcome back. So that then takes us on to agenda item 7, which is street works changing from noticing to a permit scheme, which is set out on pages 75 to 150. And I can see that we have been joined, and I'll hand over first to James.
Thank you, Chair. So highways, whether by the council, utility companies, or indeed anybody else. So the council's street work function is designed to minimise disruption to the highway network and all the highway network's users. The government created new legislation to move from a noticing regime to a permit scheme. York, like all authorities, have historically used a system of notices, which is where works promoters, primarily utilities, tell us when they are going to do works on the highway, and we inspect and manage that disruption that I talked about. This new legislation and the proposed permit scheme will require those works promoters to actually apply for permission from the council as the highway authority. And the purpose of that is to allow highway authorities to move to more proactively manage works on the highway and reduce and control that associated disruption. The government have been actively promoting these schemes and have written to us again recently asking for an update on our progress to a permit scheme, hence why we're doing this in the middle of a pandemic, I suppose. So the report updates you on the next steps in adopting a permit scheme and on the consultation we've taken. And I'm joined by Hélène Vergeroux, who's our Traffic and Highway Development Manager, to take you through that consultation. If you'd like to follow on, Hélène.
Hello, thank you, James. Thank you, Chair. Yes, we are proposing a permit scheme extending to all adopted highways in the York area. We propose to charge for permits, as is shown in Annex B in the papers that have been given to you. And this shows a proportional approach to our charges, with higher charges on what is called the strategically significant network, so the streets that have more traffic and are key, for example, to our bus network, and lower charges for maybe smaller strategically less important streets. Within all of this, within the maximum amount allowed by the Department for Transport. So there is a limit to what we can charge. Consultation feedback from the utilities and their contractors was very much focused on the fee levels, because obviously they will have to pay those fees, and utilities were generally asking for lower fees or no fees on the non-strategically significant streets. But we feel that this is not acceptable because those streets are important to residents and still require our team to check what the utilities are doing and check that they're reinstating properly. And also our proposals in terms of fees are very much in line with schemes in the region. So we think that we should follow this approach. The key benefits of the scheme are our ability to fund additional staff for the street work team from the revenue generated for the permit scheme. And that's showed in Annex F, and that means that we will have more inspectors and more staff able to coordinate the works. It also gives us, the scheme also gives us additional controls because we will be able to refuse permits, something that we're not able to do at the moment. So all in all, we think that this should result in safer streets, less disruption for all road users, not just drivers, but also cyclists and pedestrians, better coordination. And benefits for the council in terms of lower maintenance costs, because reinstatement should be done better by the utilities as we'll have more control. The scheme cannot generate a surplus. We need to balance the cost and the revenue. We're not allowed to generate a surplus. This is why we've set the fees as shown in Annex B, and we're proposing a 1-month grace period just to make sure that the system is all up and running and we have a good relationship with all the utilities and their contractors before we charging them, make sure that everything is running smoothly. And we will then monitor income and cost. We have to report annually for the first 3 years of the scheme, and then we can adjust the charges if we are charging too much or too little. And this is a requirement from the legislation. So our recommendation as per option A is for you to approve the scheme presented and aim for implementation in April 2021. Thank you.
Thank you very much for that update and introduction. I'll first go to Councillor de Gorne.
Thank you. This is certainly a very welcome step forward for the council. As you say, it's an issue which impacts significantly on the community at large, whether it's bus operators, deliveries, local residents. And I think that this hopefully will provide a much more clear and process for all concerned. One question which I would ask is, I mean, I think the main impact that residents would want to see is, as you say, the sort of efficient management of road space, and in particular, a thorny issue is about the quality of the work of reinstatement after the work has been carried out by operators. And so it's just really to get some reassurance that will be a key part of the programme to check on the standards of reinstatement, and presumably there will be feedback following the first year of operation of this to see that is something which we are able to ensure through the permit scheme, that we can actually maybe possible to even sort of report more in a more quantifiable basis about, you know, what different operators, what standards they're meeting going forward in the future.
So I would hope that this would be an outcome of the scheme because of the additional staff. It's not really an outcome from the change from noticing to permits, because the inspection regime doesn't change and the reinstatement guidance doesn't change. But the fact that we would have more staff on the ground to undertake more inspections should definitely help us.
Thank you.
Councillor Waller.
Thank you, Chair. I very much welcome this. I have acquired quite a few grey hairs as a consequence of utility works and reinstatement. So I think that's having more inspection will be a considerable benefit. I think I'd also like to know about how this will lead to residents understanding more. So more information to residents about what's going on, whether a road is awaiting inspection and therefore there is work to complete versus where a road's been handed back and therefore what you see is what you get, and if you're unhappy then they generally, residents generally complain to their ward councillor, but it's understanding flows of communication.
So again, this might be something that we can improve through additional staff, but the responsibility for communicating with residents is very much with the utilities under this regime. So it is something that we can push them to improve. And I think the additional staff would help us do that.
Thank you very much for those answers. I can't see any other indications, and obviously the report's been welcomed by both councillors de Gorne and Waller. So we have the recommendations in front of us between pages 75 and 150. If I could see all those in favour of accepting those. Thank you very much. That's a clear majority in favour of accepting those recommendations. And that then takes us to agenda item 8, urgent business. And you'll be pleased to hear that I have not been informed of any urgent business this evening. So just a thank you all for either watching, joining or taking part in the meeting. And I'm sure I'll see you next month for the next executive meeting. Thanks all. Bye-bye.